Hi class, back again with module 5, objectives 2 and 3, and I made a new background figuring you were getting sick of the old one. Okay, let me go ahead and share my screen. Whoa. And get on to objective 2. So objective 2 is to discuss how psychoanalytic concepts relate to addiction, because you're probably already like, what in the heck is all of this stuff with defense mechanisms and ego and superego and all that, and how does that relate to addiction? So it's kind of a stretch in some ways, to tell you the truth. And the upshot here is going to be that, you know, psychoanalytic theory does not really say a whole lot specifically about addiction, but I'm going to tell you what it does say. Well, here are some assumptions about drug use from psychoanalytic theory. Number one, substance use is considered to be a symptom of a deeper unconscious problem. The problem comes first. The unconscious conflicts are causing this problem, this set of conflicts in us, and that may come out symptomatically with substance abuse. So we use substances as a symptom that we have. It means that we have more unconscious problems. The psychological problems, therefore, come first. We've developed these, remember, from childhood, and then that causes us to then compensate, in a sense, with substance use. They really, psychoanalysts don't really distinguish between different kinds of addictions, different kinds of substances. For example, alcohol and marijuana, they're not really seen as different. There's also no real differences in severity and subtypes. It's just one addiction. An addiction will indicate that those conflicts are pretty severe. If there's a presence of addiction, that will indicate that we've got a severe psychopathology, severe conflict on our hands. Addiction in psychoanalytic theory results from this kind of psychological hunger, which ultimately is coming from the id, right? That's saying, I want. And then that has to be combined, though, with the availability of drugs. And without the availability of drugs and alcohol, you're not going to see addiction happening. So it doesn't mean that the unconscious conflict invariably results in addiction. It only does so if there's drugs and alcohol available. So in that sense, there's a little bit of a nod to environmental factors. Okay, so the application of psychoanalytic theory to substance use disorder is a couple of things we can talk about. One is resistance. Resistance is really common in treatments for substance use disorder. So people will resist. They'll miss appointments. They won't show up. They won't want to talk about things. They'll become hostile and things like that. So that concept of resistance is alive and well in substance use disorder treatment. Denial also, which is a defense mechanism, is also really, really common. So the person will say, well, yeah, I used, but I don't have a problem, you know, I don't have an addiction. That's not my problem, you know what I mean? But I may be using. The id is a concept which you can imagine relates to substance use disorder. The id would presumably interact with some of the drug effects in the body. That's going to lead to craving. Remember, the id is operating on this instinctual pleasure principle. I want what I want. I got to get it. And then that leads to kind of impulsive use. If you're repressing a whole lot of conflict, one idea is that all this unconscious conflict and the repression of it leads to this seeping out of negative feelings, maybe depression, anxiety, and things like that. And the substances may be used to medicate those kinds of psychological problems. Okay, so let's get into this self-medication hypothesis, because the idea here is that, and this is a common idea, you know, I mean, in our society, is that, you know, we're using substances because we're depressed, because we're anxious, there's this negative emotion that, again, is stemming from these unconscious conflicts way back in the back of our brains. And that negative emotion causes us to self-medicate. So I want to calm down those emotions, and so therefore I self-medicate. Now, this is just a little graphic I pulled from the internet, but these are really, really common. The idea of self-medication comes from psychoanalysis, and we've talked about it a little bit before, and we talked about other problems and substance use, other psychological problems, that sometimes other psychological problems can cause substance use, and we're going to get into that a little bit, in this sense of, I'm treating myself. I'm going to make myself feel better. Okay, so, but one fair question is, what does the research show about this concept of self-medication? The idea that you have a basic psychological problem and that you're treating using the substance. There's some evidence for it. Sometimes distress causes substance use. So people are distressed and they want to feel better, and that causes them to use substances. But generally, well, let me get to another piece of evidence for it. Psychological disorders, if you have a psychological disorder, you're more likely to use substances. We saw that in the last module 4. So psychological disorders are going to increase our risk of substance use disorder. So those are some findings in favor of it. But get this, more likely than not, negative emotion is a consequence or comes after substance use rather than before it as a cause. So negative emotion does definitely go along with substance use, anxiety, depression, but it usually happens after substance use. The first time someone's going to be using, they're going to a lot of times be using in the presence of more positive emotions. Okay, so another hypothesis that comes out of the self-medication hypothesis is that depending upon your problem, you may end up trying to turn on my phone. You may end up with a particular type of substance. So if you, for example, are very depressed, you might end up with this alcohol use disorder, because alcohol calms you down. I'm sorry, I said that wrong. If you're very anxious, then you might end up with an alcohol use disorder, because alcohol kind of calms down that anxiety. It's a depressant, right? If you are very depressed, you may end up wanting to use stimulants because that kind of amps you up, some cocaine or some meth or something like that, that's going to amp you up if you're depressed. That's the idea behind self-medication. We would medicate according to the particular problem. So what we should see is that depression goes along with stimulants, and that anxiety goes along with depressant drugs, right? But unfortunately, or unfortunately for psychoanalytic theory, the data do not show that. In fact, alcohol is more likely to occur with depression, which it sounds like that is not much of a self-medication, because it may make your depression a little bit worse. Alcohol also goes with antisocial personality disorder, which is a disorder in which people become sort of manipulative and aggressive. Marijuana co-occurs with delinquency and depression. And so it's just like the way that these drugs and psychological disorders go together just doesn't really speak to self-medication very well. So the upshot is that self-medication hypothesis is there. It's, again, part of the popular imagination, but there's not actually a lot of evidence for it. It's really limited. The amount of evidence is not very well supported. Okay, we're going to get into objective 3. We're going to talk about how psychoanalysis is used for treatment of substance use disorder. Now, we've got to then, in this objective, move into a kind of modern psychoanalysis, because traditional psychoanalysis is not typically used for a substance use disorder nowadays. So But let me get into this issue of therapists in general, because psychoanalysis and Freudian theory has become part of our popular imagination, we use these concepts all the time. We say, "Oh, you're in denial. You know, you've got an alcohol use disorder, and you're just denying it. You're resisting treatment, and blah blah blah." Right? A lot of therapists, a lot of providers will use those concepts, but they don't even necessarily realize their origins in psychoanalytic theory. And you might have used some of those concepts. You might have said that somebody was anal, right? That comes from psychoanalytic theory, but you don't really realize that it does. Okay. So nonetheless, psychoanalytic ideas have influenced the way that we think about substance use. So we think about things like denial and resistance, but thinking about that doesn't necessarily translate into a treatment. And so what, again, is the treatment? Okay. And this is where we deviate from typical psychoanalytic theory, which, again, I want you to see in a skeptical way, because essentially psychoanalytic theory doesn't really give us much of a roadmap when it comes to substance use disorders. And part of that is because they're seen as secondary to the bigger problem, which is the repressed conflicts. Okay, well, the current use of psychoanalytic treatment for substance use disorders, basically, as I was mentioning earlier, this kind of traditional Freudian psychoanalysis where someone's laying on a couch and the therapist is there interpreting the dream interpretation, all free association, all that stuff, unlikely to be used. There's a lot of modifications that have taken place by people who still call themselves psychoanalysts, but they use different things. For example, the therapist or the analyst will take a much more active role in the therapy, talking more, prompting more, asking more questions, commenting on things. And they take more of a role of a collaborator in the therapy than the typical role of the analyst or the traditional role of the analyst. They focus more on the external environment in addition to the internal environment, because remember, we were focusing entirely on this unconscious mind and what are these unconscious conflicts. And in today's psychoanalysis for substance use disorders, there's also going to be some attention to the external environment. Where do you live? Who are you living with? Where's the support? Where is the safety? They'll also teach things like relapse prevention, and there is where a lot of the environmental stuff comes in. How do we remove the prompts to use substances? And then finally, they integrate harm reduction techniques. And harm reduction are ways of using substances in a way that produces less harm. So here are some examples of harm reduction here. Naloxone is a way of, you've probably heard of Narcan. There's a nasal spray and stuff, and they give it away at pharmacies. And you can get it even, I believe, without a prescription now. And it's if somebody's overdosing, that they would, you would be able to stop the opioid effect from an opioid overdose. And save their lives. That's harm reduction. You're not going to die if you have that. If somebody has that on them and they can administer it to you. Syringe exchange, where you turn in dirty syringes and you get clean ones. Harm reduction because you're less likely to get HIV and other things. Nicotine patch, right? Or nicotine gum. If you use some other form of nicotine, then you're not harming the lungs in a way that you would if you were smoking. And here are some other examples, methadone and things like that, having a designated driver. So let's get some take-home points for Module 5. Psychoanalytic theory has contributed to how we understand substance use, and we use a lot of the concepts from psychoanalytic theory, but in terms of an integrated theory that tells us how to treat things, we really don't don't have that. Many concepts and treatments for substance use are not grounded in evidence. Things like the self-medication hypothesis sounds good, but unfortunately, it just is not supported by research. Ideas about self-medication are definitely part of the culture, but the evidence for them is limited. Newer psychoanalytic and psychodynamic, there's another name for it, psychodynamic approaches are incorporating non-traditional techniques, things like harm reduction, and the therapist playing a more active role. So I teach about psychoanalytic theory because it's important, because people talk about it a lot and people use a lot of the concepts. But, when it comes to substance use disorders, there are certainly better theories and better therapies. Okay, I hope you enjoyed Module 5, and I hope you have a great day.